So does cataract surgery hurt?
There's all sorts of myths out there, and it's amazing. Some people, well, many people believe we actually take out the eye, do the work and put it back in. I mean, let's be clear on this. We do not do that.
Okay, good. That's good news.
So what cataract surgery involves from a patient's perspective is you come into a hospital, into a unit, and the first thing we do is we give you some mild sedation. So we give you a tablet, usually, which relaxes you, and it just helps you relieve the anxiety and the stress. The next thing, you come to the operating theatre, and we lie you flat in the bed, and we put some eye drops in. Now those eye drops are, firstly, anaesthetic. Very, very powerful anaesthetic drops, which numb the entire surface of the eye and also the edges of the eyelids. And we do several rounds of that, and then we bring you into the operating theatre, and we clean the eye, place a sheet over the face but lift it up, so it's almost like being in an oxygen tent, and the only thing exposed is the one eye we're going to do the surgery on. The next step is more anaesthetic drops, so by this stage you are well and truly marinated in anaesthetic.
Right.
And also some antiseptic drops, and they're critically important in preventing infection, because obviously everything we do, we want to minimize the risk of infection. So antiseptic drops to sterilize the eye. And then we make our tiny 2mm keyhole incisions, which you absolutely will not feel.
But you're awake the whole time.
Oh yeah, you're awake all this, and you're simply looking, it's as if you're looking at a bright light in the ceiling, like one of these spotlights.
Right.
And you're aware of movement in the periphery of the vision,
Okay.
but at no stage should you see anything coming directly at you. That's that shouldn't happen. You just be aware of things moving in the edge, but you can't see what I'm doing because I'm out here.
Right. But what if I'm moving my eye, and what if I'm kind of just moving it involuntarily?
Small eye moves are not a problem at all. They're absolutely not. And in the microscope there are 3 little lights, and we give you your choice. You can look with whichever the lights you want, and that just keeps the eye in the correct position.
And everybody just manages to do it.
Absolutely. I mean, occasionally we have patients who sometimes are hard of hearing, sometimes English may not be their first language, sometimes patients who may have dementia. And in those situations, then it's my responsibility to have picked that up beforehand, and I've put measures in place that they're very, very clear, that you just need to look in the general direction of the light. It doesn't have to be exactly spot on, but in the general direction is fine. And then that's it really. A lot of the operation is as if patients describe it as if you're underwater in a swimming pool, looking at the sun, and you're aware of someone at the edge of the swimming pool, but you're not really sure what they're doing.
Right. So at no time during the operation are you feeling any pain?
You should not feel anything throughout the operation.
And what about after, when it's done? Is it something that aches?
Most patients turn around and voluntarily, I've heard this hundreds of times from patients, they say, I would much rather have my cataract done than go to the dentist.
Right.
Now, no disrespect to dentists, but the experience and the level of discomfort or perception, or the experience for the patient is far, far nicer to have a cataract operation than to have your teeth cleaned. Now afterwards, it's very, very common for people about an hour after operation to notice that the vision is starting to sharpen, but it's foggy, misty vision. There's enough to see you're here and to move around, but there should be no pain, no discomfort. Occasionally people say they're aware of kind of a gritty sensation as if they've got a hair or an eyelash in the eye. It's temporary, usually is gone within 24, 48 hours.
Okay.